Hello guys, hope you're all okay, you're all enjoying your life and you're also enjoying watching my videos. I'm Dr. Arshad Nadeem Awan with ultrasound and radiology teaching videos. Today I'm going to discuss about one of the disease which is called as Osgood Schlater disease. Osgood Schlater disease is actually traction epiphysitis of the patellar tendon. Patellar tendon insertion is a tibial tuberosity, and because of this disease, patients feel severe pain. And usually, adults are commonly involved, but it may occurs in any age of life. So, therefore, you must pay attention when patients come and explains to you that he or she has a severe pain in the inferior part of the knee joint. This is what the common thing is. Most of the time physicians ignore that and then refer it to the physiotherapist, and physiotherapists usually try to focus on the patellar tendon, but exactly he doesn't know that what the exact process is going on. So I think this video will help at the same time to the GP physicians and to the physiotherapists, and it will help them to figure out what exactly the Osgood Schlater disease is. In Osgood Schlater disease, it happens to be either unilateral or bilateral. Most commonly, it is unilateral. The patellar tendon, which inserts at the tibial tuberosity, it becomes thickened. The first important point is a thickening of the patellar tendon at the insertion point. The second thing is ossification. It gets ossified. So these two things happens with the patellar tendon. What happens with the tibial tuberosity? Because of the traction, there is small fragmentations of the tibial tuberosity, which you can appreciate on the CT scan, you can appreciate on the radiograph. On the radiograph, if there is expert and skillful eye, it can easily pick these findings, and on the CT scan it can be easily picked. For the MR, if you do the MR, so in the fragmented part you can see the edema of the bone would be there. The third important thing is that is associated soft tissue swelling. Associated soft tissue swelling can be picked on the clinical examination, on the clinical assessment, and physiotherapist can easily pick that findings. So in case of any doubt, if you think that is it tear or is it rupture or it is patellar bursitis, the one very important thing is advise simply the X-ray. That would be X-ray lower extremity knee joint in epi and lateral view, and mark it that I'm going to look for the Osgood Schlater disease, whether it is present or not. This is the one technique my colleagues, physiotherapist colleagues or GP colleagues can advise to the patient to reach to the Osgood Schlater disease. The second important thing is that they can advise the ultrasonography with the note that they wanted to look for Osgood Schlater disease. So on the ultrasound, they can also pick the point thickening of the patellar tendon, ossifications of the distal patellar tendon, fragmentations of the tibial tuberosity. And the third thing, these days my physiotherapist colleague, they do have ultrasound in their clinics. They simply put that on the lower part or insertion of the tendon, and they can pick these 3 points. That the first one is the patellar tendon would be thickened there. The second thing is there will be ossification, calcific foci there. The third thing, there will be fragmentation of the tibial tuberosity. And the fourth, if you have any access to the Doppler, so there will be vascularity because of the inflammation. And the fifth important point, which can you also be picked on the ultrasonography, that is a peripatellar bursitis. There will be inflammatory exudations over there. So how it will appear on the ultrasound imaging, on the X-ray, on the CT? Let's start watching these images, and at the end, before the diagnosis, you better advise the patient for the knee X-ray epilateral view and ultrasonography with the advice that you wanted to see Osgood Schlater disease. So let's start watching these images. On this knee radiograph for the Osgood Schlater disease, you can appreciate that the ossification and thickening of the inferior patellar tendon adjacent to the tibial tuberosity. So on this image you can appreciate that the anterior tibial tuberosity is showing an fragmented portion, slightly elevation, irregularity, and tibial tubercle is slightly protrude, and there is adjacent soft tissue swelling. So this radiograph showing Osgood Schlater disease clearly. Here on this image, what happens, it's an image which is clearly indicating beneath the patellar tendon there is ossification, and because of the ossification there would be traction fragmentations as well. This is another view, lateral view, and here you can appreciate that the patellar tendon on the area where the patellar tendon inserts, you can appreciate small fragmentations of the tibial tuberosity can be seen. Soft tissue swelling can also be seen here on that radiograph, and for further workup you have to have the ultrasonography to pick the thickening of the patellar tendon, and you can confirm Osgood Schlater disease on the ultrasound as well. This is the radiograph and the MR images, and on MR images you can clearly appreciate the integrity of the patellar tendon, distal patellar tendon, where it inserts with the tibial tuberosity, and tibial tuberosity area showing slightly fragmentation, and also bone marrow edema can be seen on the MR images. So simple radiograph can also be helpful. For the further detail, the MR examination is good, and you can also advise ultrasonography. It's the ultrasound image, and you need to have a small high resolution probe, and you should have to look here on this image. You can appreciate small fragmentation and ossification of the distal patellar tendon, and the thickening of the patellar tendon can also be seen. Beside this, you can also see the small fragmentation detached from the tibial tuberosity. So this is Osgood Schlater disease on ultrasound. Yes, for the better understanding here, this is another scan, ultrasound scan. On the ultrasound scan, you can pick very minor details, and it was really helpful, and you can assess the damage of the patellar tendon, the ossification level of the patellar tendon, and also small fragmentation and ossifications of the lower part or the distal insertion level of the patellar tendon. Beside this, you can also pick the point of the peripatellar bursitis. Here on this ultrasound image indicated by the white arrow, you can clearly appreciate that the distal insertion point of the patellar tendon show dense calcification. So there will be a dense calcification, there will be fragmentation of the tibial tuberosity, and there will also be thickening of the patellar tendon, and sometime you can also see some of the fibula or fibular pattern would be slightly detached, or there might be a micro tear as well. Sometime there will be peripatellar bursitis, and these all points can be confirmed on the ultrasound imaging, which is non-invasive, and this is all about the Osgood Schlater disease on the X-rays, MR and ultrasound.